IEPs, IPEs, HTPs, and a little IHP. Oh my. Hello, I'm Heidi Lawyer with the Parent Educational Advocacy Training Center. Welcome to this short webinar featuring information from one of our newest resources on IEPs, IPEs, and HTPs for individuals with disabilities. This project is funded by the RSA Parent Center grant that PETSI holds for Region B1 and by RAISE, a SPAN project providing technical assistance to support youth and young adults with disabilities and their families during transition. The Parent Educational Advocacy Training Center is the federally funded Parent Center for Virginia and the federally funded RSA Parent Center for Virginia, North Carolina, South Carolina, Tennessee, Georgia, and Florida. PETSI builds positive futures for children and young adults by working collaboratively with families, schools, and communities in order to improve opportunities for excellence in education and success in school and community life, with a special focus on children with disabilities. This includes providing outreach to families through one-on-one consultations, in-person and virtual workshops, and resources that are easy to understand. Plans, plans, plans. There are so many types of plans for students and adults with disabilities. It's important that the various plans that relate to education, employment, independent living, and healthcare are all coordinated in some way, even if they cover different areas. That coordination between plans and between the providers that help implement those plans will help facilitate greater success. Under funding through RSA and RAISE, PETSI has put together a resource document that looks at these three important plans: the Individualized Education Program, IEP, the Individualized Plan for Employment, IPE, and the Healthcare Transition Plan, HTP. We will review the key parts of each and talk about how they can and should work together. The document also contains a brief description of the individual health plan, IHP, which some students with disabilities may have to ensure their medical conditions are appropriately managed. This image shows page 1 of this great resource document. The document is available in English and in Spanish, and there is a version for families and a version for Parent Center staff. I'm going to briefly share some of the information that can be found in this resource document. I will be answering the same basic questions about the IEP, the IPE, and then the HTP. Let's start with the Individualized Education Program and look at the basics. Who gets an IEP? Students with disabilities who have been found eligible under the Individuals with Disabilities Education Act, IDEA, for special education and related services. What is an IEP? An IEP is a written plan that includes goals and objectives and specialized services and supports that support your individual needs as a student with a disability and that ensure that you receive a free, appropriate public education. Who develops the plan? An IEP plan, an IEP team that includes your parents, you, the student, school staff, and others work together to develop the IEP. At 18, you get to make your own decisions, but you can still give permission for your parents to participate so they can help you, or they may have a legal document that allows this. What is the plan based on? The IEP is based on the results of a variety of assessments, tests that show your current strengths, challenges, and how you are currently performing in your classes and in other services you may be getting. At age 16 or earlier, if needed, a transition plan will focus on your goals for life after high school, and more specialized assessments will take place. Many states require transition planning earlier, at age 12 or 14. How long does the plan last? You will have an IEP for as long as you are eligible for special education services. That decision is made every 3 years. You can receive services up through your 22nd birthday, unless you graduate with a regular or advanced diploma. Your IEP must be reviewed every year or sooner if you and your parents don't feel you are making progress. What is included in the plan? An IEP has many parts. These include, but are not limited to, information on your current level of performance in your academic classes and how you function every day, things like speech, social skills, getting around. Goals and objectives that will help you progress. Special education and related services, like speech or occupational therapy that you need to progress in your education. If you are transition age, 16 by federal law, but younger in some states, transition goals and services addressing independent living, employment, training, and post-high school education. Where services will be delivered, in the regular classroom, in a separate classroom, etc. How long each service will be, e.g. speech therapy, 3 times a week for 30 minutes each. Who gets an IPE? Students or adults with disabilities who have been found eligible for vocational rehabilitation services under federal and state eligibility criteria who are pursuing employment. What is an IPE? An IPE is a written plan that shows your goal for work and the services you will get to help you reach that goal. If you are a student, your IPE will instead say what your expected employment outcome will be when you leave school. Who develops the IPE? If you apply for vocational rehabilitation services, you, your parents if you are under 18, and your VR counselor develop the IPE. If you are over 18, your parents will not participate unless you give permission for them to do so, or they have a legal document that allows them to do so. A student in transition can have both an IEP and an IPE, and the VR counselor may attend IEP meetings. What is the IPE based on? An IPE is based on existing information if it is current. If you are a student, information from the school will also be used as part of the process. Your counselor may also want you to have other assessments to look at your strengths, resources, priorities, concerns, abilities, and career interests. How long does the IPE last? The IPE lasts as long as it takes for you to meet the employment goal. If your employment goal requires a college education, your IPE will last longer than if you are attending a 6-month job training program. Your IPE must be reviewed every year or sooner if you don't feel like you are making progress or things aren't going well. What is included in the IPE? The IPE also has several sections, including the following: your competitive integrated employment goal agreed on by you and your counselor. It must be a goal that you want and be based on your career interests and choice. If you are a student, your goal would be your expected employment after high school, which could be after further post-secondary education. A list of steps needed to reach your goal. The specific services needed to reach your goal, which could include vocational counseling and guidance, assessment, assistive technology, help with benefits planning, transition services, on-the-job training, job coaching, supported employment and attending college, or other job-related services and supports. Who will provide these services? You have the right to choose. Who gets an HTP? Anyone who needs to move from the pediatric healthcare system to the adult healthcare system. This is not a required plan, but it is a helpful one to have. What is an HTP? The HTP is a plan to help you manage the transition to adult healthcare, including finding providers, making sure you have the right insurance, and learning how to manage your healthcare. Who develops the HTP? This is a plan that you will make with your family and your medical providers. You may have to meet separately with different providers. You may also want to talk with your IEP team and/or VR counselor about what to include in this plan based on your specific needs. What is the HTP based on? An HTP can be based on a healthcare skills assessment that looks at a variety of skills needed for you to manage your own healthcare, with support if you need it. It looks at where you are in terms of having those skills or developing them. The healthcare skills assessment can be formal, like reviewing a checklist, or informal, discussion with your family and teams. How long does the HTP last? Once you have successfully transitioned from pediatric to adult healthcare providers, you may not need the HTP, but you can keep it as long as it is helpful, particularly for looking at skills that you may need and checking off those you have learned. What is included in the HTP? Unlike the IEP and IPE, which have specific required parts, the HTP includes the items you and your team think are needed. These may include the following: medical summary / history of medical conditions, allergies, hospitalizations, etc. Current medications and any information about side effects of current or previous medications. Names and contact information for providers and your pharmacy. Legal considerations such as healthcare power of attorney, advance directive, supported decision-making agreement, guardianship. Healthcare skills and abilities and needs. For example, understanding your medical condition, managing medications, managing doctor's visits, decision-making. The HTP lists current skills, abilities, and goals. For example, there may be goals around things like managing medication, knowing what to take and when and how to refill, making medical appointments, asking questions during medical appointments, or taking care of equipment like hearing aids or contact lenses. But you and your family need to ensure that there is a way to learn these skills. The family may be comfortable teaching these skills at home, or you may feel like you can learn them on your own. But you may need the support of professionals to make sure you can become as independent as possible of managing your healthcare. This is where the IEP and IPE come in. Students with disabilities who have an IEP must have a transition plan. The federal age requirement to have such a plan is 16. However, many states require planning at an earlier age. The transition plan, which is part of the IEP, sets forth post-secondary goals, what will happen after high school, annual goals to meet those overarching post-secondary goals, and the services and activities needed to achieve those goals. If a student is also a vocational rehabilitation VR client, the IPE sets forth the student's employment goal and the services, steps, and activities needed for the student to achieve their employment goal. The skills needed to transition from pediatric healthcare to adult healthcare can be incorporated into the IEP as independent living goals, or in the IPE as services to develop skills needed for successful employment. Some of the goals may be more general, such as self-advocacy skills, which will assist the child in all aspects of life, and some will be more specific to healthcare management. Excuse me. Talk to your teams to determine how you can learn the skills needed to be an independent adult and know the supports you may need in managing healthcare needs. Here are examples of healthcare-related goals that could be included in an IEP. By the end of the 2022 school year, I will be able to identify my doctors and know how to contact them with 80% accuracy. By June 2023, I will be able to demonstrate with 90% accuracy that I know the medications I take and when I need to take them. By June 2023, I will be able to make an appointment with my primary care doctor by calling the doctor's office or using the online portal by myself with 80% accuracy. Your IEP team will need to determine how to measure progress, whether it is tracked through role play, observation, or data tracking. Here are some more examples. By the end of the 2022 school year, I will be able to name my medical condition or disabilities, for example, autism, epilepsy, etc. By September 15, 2023, the date of my next physical exam, I will be able to prepare 1 to 3 questions to ask my doctor at an office visit and ask those questions at my visit with no more than 1 prompt. By the end of the 2023 school year, I will be able to know when I need to request refills on my medication with 75% accuracy and no more than 1 prompt. You get the idea. Now let's talk about how IPEs can also play a role in helping you achieve your HTP goals. So the IPE is focused on an individual obtaining an employment goal. For example, if you want to be a computer programmer, then the services and supports provided through vocational rehabilitation might include payment for further schooling, assistive technology that might be needed, on-the-job training, assistance in obtaining an occupational license or equipment needed. But to be successful on the job or in college, you may need to be able to manage certain healthcare needs, like knowing when to take medication, when there is an emergency, when to ask for help, or any other needs you have identified. VR can help. Excuse me. The IPE should include all the services you need to get and keep a job in your chosen field. Those services can include things like life skills training, independent living skills training, and self-advocacy training. And the health-related goals on your HTP can be addressed through these types of services. For example, if you need assistance in managing medication in order to be successfully employed, independent living skills training may help. Or the IPE may fund a specific device that helps you track your medication, like a smartphone or iPad. If you need accommodations on the job to meet your healthcare needs, for example, extra breaks to test your sugar levels if you have diabetes, self-advocacy training can help you feel more comfortable in asking for accommodations. If the service is related to gaining or maintaining employment or advancing in employment, and there is no other agency responsible for funding the service, it can be a part of the IPE if agreed to by you and your VR counselor. So we've talked about 3 plans that can be coordinated and work together to help achieve post-high school outcomes. One additional plan a student may have is called an individual health plan, an IHP, while the HTP includes medical history, background information, provider contact information, legal information, etc. The IHP focuses on how to manage the student's medical conditions while in school. The IHP is generally developed for students who have more complex needs or required skilled medical care. It is a written plan that is developed by the parents, the student, depending on age, school nurse, and other relevant individuals, including as appropriate the student's IEP or 504 team. The IHP is a separate document from the IEP or 504 plan. A 504 plan is a plan for students with disabilities who do not need specialized instruction like they would receive in an IEP, but who may require certain accommodations to be successful in their education, like longer time for tests, sitting up front, classes on the first floor, etc. Students with IHPs generally require medically related services during the school day. This could be providing insulin injections to a student with diabetes. It could be something like caring for a tracheostomy or ensuring epinephrine is available, and there is a plan for use for children who may have an allergic reaction. The IHP is used to communicate health and medical safety needs, detail emergency interventions, and detail the specific actions that school staff are expected to take. Generally, the school nurse is responsible for managing the IHP. If your school does not have a school nurse on site, Ask the school principal who has oversight and responsibility for implementing your child's IHP. A physician or provider does not have to review or authorize the IHP, but all medical interventions must be authorized by a prescriber. The IHP should include contact information for the student, parents, and relevant physicians, the student's diagnosis, information about recent hospital admissions, list of medications, including dosage, frequency, and side effects, allergies, equipment used or needed, public and private providers, medical history, review of body systems. Are there issues with swallowing, hearing, kidneys, etc.? Problems to watch out for and healthcare goals. The IHP should specify each procedure or intervention that is needed, how to determine if an emergency intervention is needed, who will implement the procedure, and what the expected outcome is. Standards of medical and nursing care practice must be followed. Remember, it is important that the various plans that relate to education, employment, independent living, and healthcare are all coordinated in some way, even if they cover different areas. That coordination between plans and between the providers that help implement those plans will facilitate greater success. Thank you very much. And if you have any questions, please feel free to contact Pizzi.